A silent crisis is literally brewing right under our microscopes, and it's threatening to make common illnesses deadly all over again. Welcome to this explainer for Pharmacy with Sabir. Today, we're diving into one of the absolute biggest global health threats of our time, antibiotic resistance.
I want you to picture this. A patient is in the hospital with what should be a routine bacterial infection. The doctors give them the standard treatment, but nothing happens. The bacteria just keep multiplying. So they try a stronger drug, and then another one. But none of our modern medical miracles actually work. This isn't some sci-fi movie plot. It's a terrifying, real-life scenario happening more and more often. And it threatens the very foundation of modern medicine. When simple infections stop responding to our drugs, we are in serious trouble.
Okay, let's take a quick look at our roadmap for this explainer. We're going to cover the resistance crisis, how antibiotics actually function, how bacteria outsmart them, the rise of superbugs, strategies for prevention, and finally some future solutions.
Let's kick things off with Section 1, the antibiotic resistance crisis. To really understand resistance, we've got to start by defining antibiotics themselves. These are incredible, world-changing medicines designed specifically to target and destroy bacteria, or at least stop them from multiplying so our own immune systems can swoop in and finish the job. Since the discovery of penicillin, these drugs have literally saved hundreds of millions of lives. Now, here is a really crucial distinction you've got to remember. Antibiotics only work against bacteria. That means they are completely, 100% useless against viruses like the common cold or the flu. When folks take antibiotics for a viral infection, they aren't curing their illness at all. Instead, they're just exposing the beneficial bacteria in their bodies to a deadly threat, basically creating the perfect training ground for resistance to emerge. Moving right along to Section 2, how antibiotics actually work. You can think of antibiotics as highly specialized saboteurs. When they enter the body, they don't just attack blindly. They seek out specific targets that are totally unique to bacteria, which is why they don't harm our human cells. For example, some antibiotics punch literal holes in the bacterial cell walls. Others jam up the machinery responsible for protein synthesis, effectively starving the bacteria. Some tangle up the DNA replication process so they can't reproduce, and others just block crucial metabolic pathways. They are incredibly precise weapons. And that brings us to Section 3, how bacteria become resistant. It all starts with natural selection. You see, when bacteria multiply, they sometimes undergo random genetic mutations. So if you introduce an antibiotic, most of those bacteria die. But a few with a lucky mutation, they might survive. And then those survivors rapidly multiply, creating a brand new, highly resistant population. But here's where it gets truly wild. Bacteria can actually share their resistant genes with completely different bacteria using tiny little loops of DNA called plasmids. It's like they're literally passing out cheat codes to survive our best drugs, a process known as horizontal gene transfer. Now, while this evolution is a natural biological process, human behaviors are basically dumping fuel on the fire. We're talking about overprescribing antibiotics when they just aren't needed, patients stopping their treatments early because they feel a little better, and the rampant use of antibiotics in livestock and agriculture just to promote animal growth. All of this rapidly accelerates the spread of resistance. Essentially, every time we misuse these drugs, we're acting as personal trainers for the bacteria, helping them get stronger. Which leads directly into Section 4, the rise of superbugs. Let's break down some of the most notorious resistant organisms out there. We've got MRSA, or methicillin-resistant Staphylococcus aureus, and VRE. We're also looking at ESBL-producing bacteria and the deeply concerning CRE, which stands for carbapenem-resistant Enterobacterella. Now, carbapenems are often our absolute last line of defense, so when bacteria resist them, doctors are essentially left empty-handed. These superbugs are incredibly difficult to treat because they have systematically adapted to survive the absolute strongest, most advanced drugs we have. The clinical consequences of these superbugs? Absolutely devastating. And this isn't just an abstract scientific concept. On the ground, it means much longer hospital stays, soaring healthcare costs, and tragically, much higher mortality rates. Plus, you have to remember that so much of modern medicine relies entirely on our ability to prevent infection. Without effective antibiotics, routine procedures like joint replacements, chemotherapy for cancer patients, or organ transplants suddenly turn into incredibly high-risk, life-threatening situations.
Okay, Section 5, strategies to prevent resistance.
The good news is we are not powerless here.
Healthcare professionals and patients alike have to practice what we call antibiotic stewardship. What does that look like? Well, it means pharmacists actively counseling patients to finish their full course of medication, even if they already feel better. It means practicing excellent hand hygiene and strict infection prevention in hospitals. It also involves expanding vaccination programs so we prevent infections in the first place, ensuring doctors prescribe responsibly, and ramping up public education so everybody understands exactly what's at stake.
Finally, let's look at Section 6, Future Solutions and Takeaways. To secure our future, researchers are exploring some truly groundbreaking solutions. We're seeing the development of entirely novel classes of antibiotics, which is huge. There's also this fascinating revival of bacteriophage therapy, which is basically using naturally occurring viruses that specifically hunt down and kill bacteria. On top of that, AI-assisted drug discovery is drastically speeding up our ability to find new molecular targets, while rapid diagnostic testing is helping doctors prescribe the exact right drug instantly, rather than just guessing. Science is working incredibly hard to stay one step ahead of these mutations. Let's quickly summarize this explainer with 5 key takeaways. Number 1, antibiotics only treat bacterial infections, never viral ones. 2, resistance is a natural biological process that spreads via mutation and horizontal gene transfer. 3, human misuse in medicine and agriculture is heavily accelerating this whole crisis. 4, superbugs cause severe clinical risks and threaten modern medical procedures as we know them. And 5, stopping this requires strict antibiotic stewardship from every single one of us. I want to leave you with this really powerful thought. Every single time we use antibiotics responsibly, we help protect one of medicine's greatest discoveries. Our actions today literally determine the medications we'll have available to save lives tomorrow. Are we moving fast enough to outsmart the very microscopic life we helped evolve? Definitely something to think about the next time you feel a cold coming on. If you found this explainer helpful, please don't forget to like, subscribe, and join Pharmacy with Sabir for daily pharmacy education. We break down the complex science so you can stay informed. See you in the next explainer.